Good afternoon, everyone, and welcome to today's session. Manali and many more across the country. Today, we have the episode 2 of our 200 hours crash course, where we pick up 10,000 most essential sure-shot issues which examiner is looking forward to check whether you know or not. So let's make the great beginning. I hope you have all downloaded the Incus quiz app. So all these topic-wise discussions we are having now, we are also creating tournaments and uploading into the Incus quiz app. So what happens is, you can also play it like a tournament and can know how you are doing rights and wrongs along with all your classmates. So let us make the great beginning. So continuing our journey in anatomy, good to see Yugender, Bobby, and many more who joined this afternoon hot session with Dr. Murali Bharadwaz. Once more at 9 p.m. tonight, I'm going to spend one more hour, having a discussion with you. So that throughout the day, Dr. Murali Bharadwaz is going to be your companion in the preparation for this slightly delayed NEET PG entrance, which gave us sufficient amount of time to prepare. So always we should find opportunity in every adversity. That kind of an incurable optimism is required for us to become the winners at any point of our life. So let's make the great beginning. Foot is the next favorite topic of the examiner. So I request all of you to keep punching the answers into the chat window. Yes. Manoj is saying, sir, please include 300 questions mock tests also. Definitely, we will do everything, doctor. Only thing you need to do is make it a point to download the Incus quiz app. And there we have created all these topic-wise questions as quiz tournaments to stimulate you to do the revision, right? Now, it is to the medial aspect during the inversion, the flutes plantar surface pieces. Inversion to 30 degrees, eversion is to 20 degrees is what you have to emphatically remember. Bone with no muscle attachment. Typically talus. There are only two bones in the body which don't have any muscle attachment. Incus, talus. That's what you need to remember. So talus has no muscle attachment. So this is the typical talus, which is the most crucial weight-bearing bone of our entire body weight. But talus has a very precarious blood supply because the blood enters distally, retrograde manner. So that is the reason talus can suffer avascular necrosis whenever there is any fracture, is what you need to remember. Incus in the ear, it also has no muscle attachment, is what you should remember. Peroneal tubercle, where do you see? In which bone do you see? We see it in calcaneum. So this is how calcaneum has got a peroneal tubercle, is what you need to remember. Now, which is the largest of all the tarsal bones, doctor, in the foot? Calcaneum. And between the talus and the calcaneus, between talus and the calcaneus, you have the sinus tarsi, is what you have to appreciate. So it is the sinus canal which is occupied by this interosseous talocalcaneal ligament. That's what I want to underscore to all of you. So this is the Achilles tendon, calcaneus, the peroneus longus, peroneus brevis, the lateral malleolus, fibula. Some of you are going to be the top orthopedic surgeons in a short period of time. So there is a peroneal tubercle. What is the importance of it? It is under this peroneal tubercle, there is a groove for the tendon of the peroneus longus. That is what you have to basically remember. Peroneus longus typically passes underneath the peroneal tubercle. Come on, punch your answer, doctor. Medial arch of the foot. How is medial arch of the foot is formed? Who is going to give me the correct answer? Medial arch of the foot. बीच में हम एक challenge आपको छोड़ेंगे ताकि आप you are also involved in answering. You know, no learning management system can beat YouTube, because YouTube में हम और आप दोनों मिलके पढ़ाई कर सकते हैं. दुनिया में कहीं भी आप बैठो, right? There may be a lot of mobile apps, blah blah blah, but nothing can beat the YouTube. You can be able to type the instant answers. I can be able to see how good you are doing. Very good. Manali is betting on spring ligament. Anjana also on spring ligament. Absolutely, spring ligament. Tom, Dick, and nervous Harry, you should remember. Tom is tibialis. Dick is flexor digitorum longus. End is artery, tibial artery. Nervous is tibial nerve. Harry is flexor hallucis longus, is what you have to emphatically remember. So if you look at all the ankle tendons from anterior to posterior, you have the Tom, Dick, and very nervous Harry. Tibialis posterior, flexor digitorum longus. You have the tibial artery, tibial vein, tibial nerve, and flexor hallucis longus is what you need to remember. Now, doctor, erector of the ankle is inserted into, which is inserted into the medial cuneiform cone hand. Who is that? Anatomy always is a grilling subject. Totally, there are about 1,000 points that you should master, doctor, in anatomy. Whether you cry, whether you don't like, still you have to mug it. There's no other way. So please don't forget Incus quiz app. आप डाउनलोड करो और ये सब चीजें टॉपिक वाइज, सब्जेक्ट वाइज, टॉपिक वाइज quiz tournaments are created. Each quiz contains 15 to 20 questions. आराम से आप खेल सकते. Every time you are answering a question, you will be knowing how the entire world answering. Where are you standing in the leaderboard? After the quiz is over, all the quiz questions will move into history tab. And in the history tab, you will be knowing a quick summary of what are your rights and wrongs. You can be able to bookmark it. You can add an audio comment, video comment, text comment, anything to each of this question that will help your other friends who are taking the test. So that way, throughout the day, so there are totally 20,000 questions, doctor. Aap kuch na kuch karo. You have to give me a promise that on the Incus quiz app, you are going to play all these 20,000 questions which are created as 1,000 quiz tournaments. The moment you do that, automatically you have the confidence that you are going to be the winner, right? A lot of coaching programs, including ourselves, we offer weekend full-scale grant tests, this and that. 3 घंटे बैठ के एक ग्रैंड टेस्ट करने के लिए उतना पेशेंस नहीं रहता हमको. अगर पेशेंस है तो that is an exception, not a rule. So that is the reason bite-sized, small tournaments, 20 questions, 15 questions. चाय पीते पीते खत्म कर सकते हैं आप. करने के बाद आपका राइट्स क्या है, रॉन्ग्स क्या है, bookmarked things, everything will become segregated, and you know very well what to revise in the last moment among your bookmarked questions. So that is the beauty part of the Incus quiz app. So doctor, most of you said A, Sarika said C. It is peroneus longus, absolutely. अच्छा भैया, pronation of the foot क्या होता है? If you take the hand, pronation means like pressing. Supination means like drinking soup. Palmar surface looking at the seal is supination. Similarly, plantar flexion along with eversion is called as pronation. So the pronator longus inserts into the lateral margin of the plantar surface of the first cuneiform and the proximal end of the first metatarsal. It enables plantar flexion and eversion of the foot and enables pronation. Whereas peroneus brevis जो होता है, it inserts into the tuberosity on the lateral side of the proximal end of the fifth metatarsal and participates in plantar flexion and eversion of the foot is what you need to remember. So very common landmark, anatomy exam also, they used to ask, what is this muscle? Before examiner used to pass last question. Extensor hallucis longus. What is this muscle? This muscle, tibialis anterior. It's very easy. Just make your toe go up. You can be able to feel the extensor hallucis longus is what you need to remember. I'm so happy to see 26 online students. Let me tell you, every day I spend with you until the NEET PG, maybe in the March. We have a lot of time, afternoon and also in the late evening. Be part of our WhatsApp group. Please give a call to 9000-868-356, our helpline number, to become part of our WhatsApp group, so that before the class starts, we will send you an alert. Also, you click on the bell sign, so that, and also before only we will schedule the broadcast. Set up a reminder so that you will get a reminder when the session starts. Now, tibialis anterior is the dorsiflexor of the ankle joint and inverter of the foot, not everter, inverter. Even tibialis posterior also is the principal inverter of the foot. So this is the favorite question of the examiner. भैया inverter क्या होता है, everter क्या होता है foot का? Favorite question of the examiner. What are all the ligaments which are involved in the maintenance of the medial longitudinal arch? So this is another batti marne wala item hai, batti marna padega. Plantar Aponeurosis, spring ligament, talocalcaneal ligament, they are all the ligaments which are involved in the maintenance of the medial longitudinal arch. But yeah, medial longitudinal arch and lateral longitudinal arch agar baat kare to, medial longitudinal arch is typically higher than the lateral longitudinal arch, and medial longitudinal arch also is like a shock absorber in your Mercedes Benz car, is what you need to remember. The summit of this medial longitudinal arch is formed by the anterior surface of the talus. And the anterior pillar is formed by the heads of the first to third metatarsal. Posterior pillar is by the medial tubercle of the calcaneus, is what you need to remember. So now what are all the various dynamic and passive supports of the medial longitudinal arch? अगर आप MBBS फर्स्ट ईयर एनाटॉमी में हैं तो मीडियल लॉन्गिट्यूडनल आर्च के बारे में 5 पंक्तियों में लिखो. शॉर्ट आंसर क्वेश्चन, फेवरेट क्वेश्चन. Remember, tibialis posterior muscle, tibialis anterior muscle, these are all inverters. Flexor hallucis longus, fibularis longus, intrinsic plantar muscles, they're all considered to be the dynamic support. Dynamic support. That is what you should remember. Whereas the plantar aponeurosis is considered to be the passive support. Now, lateral longitudinal arch. Let's talk about this lateral longitudinal arch. It is the proximally it is by the 3 cuneiforms, distally by the 5 metatarsals. They constitute the typical transverse arch. So now comes one of the favorite questions of the examiner. In fact, 2 questions मैं बताता हूं आपको. आपके 100 pages notebook में लिख लो. मुरली भरद्वाज के साथ पूरा 200 घंटे का चाय पे चर्चा. 200 hours, 10,000 MCQs, which are very hot, topic wise. मेरे साथ डिस्कशन में पार्टिसिपेट करो. You will, I promise you that you will be in the top 1000 ranks. That's my promise to all of you. But you should promise me that you will come to attend the live session, because दुनिया में कोई भी अध्यापक को, any teacher in the world, always enjoys the company of hundreds of students. Paid, unpaid, free, nothing matters. That's all immaterial when teacher and student are sitting. There is an immense satisfaction which can't be valued with money that comes to a teacher when he can be a piece of usage. If he can be of a real utility value to bring the power of learning among his students. So that is the reason I am grateful, thankful to all of you. In spite of afternoon, 2 o'clock, you all have joined this session. फिर 9 बजे को फिर मुरली भरद्वाज के साथ चाय पे चर्चा. Please don't forget, ask your friends also to join. So what are the structures that pass deeper to extensor retinacular? भैया एक निमोनिक रहना है इसके लिए, नहीं तो याद रखना मुश्किल हो जाता. The Himalayas are not dry places. Obviously, Himalayas dry कैसे होता? Medial to lateral, you can remember. The tibialis anterior, Himalayas, extensor hallucis longus, or anterior tibial artery. Not is a nerve, deep peroneal anterior tibial nerve. Dry is extensor digitorum longus and places is peroneus tertius. So these are the structures which are passing from medial to lateral under the extensor retinaculum of the ankle. बट्टी मारने वाला item है, definitely एक MCQ आएगा. Then what are the structures which are passing deep to the flexor retinaculum of the ankle? Whenever a patient comes, what will nurse will tell? The doctors are not here. Where are they? OPD में. So medial to lateral, the doctors are not here. Da is tibialis posterior. Doctors are flexor digitorum longus. R is an artery which is posterior tibial artery. Not is a nerve which is posterior tibial nerve. Here is flexor hallucis longus is what you need to remember. So if there दो चीजें, एक फोटो ले लो, स्क्रीनशॉट ले लो, जेब में रखो, कल के एग्जाम में you have to reproduce. Extra fingers and toes is called polydactyly. At which joint inversion of the foot occurs? Who is going to give me the correct answer? Come on, punch your answer. Question number 50. At which joint does inversion of the foot occur? Yes. At which joint inversion of the foot occurs? Let me check. Vidyasagar is presenting cuneo-navicular clean bowl. Akram, Sayada are betting on tallow, calcaneal. Badhiya. So the subtalar joint is also called talocalcaneal joint. So the inversion. Typically, inversion will be 2/3, eversion will be 1/3. It happens at the level of the subtalar joint is what you need to remember. So similarly, at subtalar joint, the tibia can undergo external and internal rotation. The talus can undergo dorsiflexion, abduction, or plantiflexion, adduction. Calcaneus can undergo inversion and eversion. This is how supination, pronation typically happen, is what you need to remember. So this is the plantiflexion, this is the dorsiflexion, lateral medial axial rotation, and this is inversion, this is eversion. You have to be 100% sure. So that is the story called foot. अभी आपको 4-5 आइटम मिल गया. क्या क्या पढ़ना है आपको आइटम मिल गया. तो आइटम टू आइटम we should finish, doctor, and our confidence levels, our scoring pattern. The moment you finish 953 topics with Dr. Murali Bharadwaz, 953 topics from 19 subjects with Dr. Murali Bharadwaz, you are already a champion. ये 953 टॉपिक्स को डिस्कस करने के लिए हम 20,000 MCQs को we will make it a platform to discuss this 953 topics. And also you sit in a tournament atmosphere on the Incus quiz app and try to do the revision. Right? Incus quiz app and try to do the revision. So Incus quiz app is not really costly, just 600 rupees per month. Less than a airport में coffee से भी cheaper है. Ideally, good learning is supposed to be affordable, accessible anywhere, anytime. And at the same time, it should be enticing, engaging, inspiring, innovative. That is what is Incus. So take every opportunity to download the Incus quiz app and try to play as many tournaments as fast as possible that you can cover the 20,000 MCQs on the Incus quiz app, so that we will run the analytics on your performance and we will quickly give you what are your rights, what are your wrongs, what are your rights, what are your wrongs, and how others are answering, and a lot of community which can add. Good to see Lovepreet Singh after a long time. You can add a lot of audio comments, video comments, text comments under the questions, each question in the mobile app, just like TikTok video, and your friends can be part of your collaborative learning exercise. Sphenopalatine foramen opens in which wall of pterygopalatine fossa? अच्छा भैया, pterygopalatine fossa एक बड़ा गुहा है. It is like a bada gufa, like Wali Sugri in Ramayana. Like that, it is a big cave. You should know it's three-dimensional anatomy. So, doctor, with the sphenopalatine foramen, the pterygopalatine fossa, pterygoid body and pellet के बीच में pterygopalatine fossa. So, with sphenopalatine foramen, it communicates with nasal cavity. With pharyngeal canal, it communicates to nasopharynx. With foramen rotundum, it communicates middle cranial fossa. With pterygoid canal, it communicates base of the skull. And with pterygomaxillary fissure, it communicates with the infratemporal fossa. And with the inferior orbital fissure, it communicates with the floor of the orbit. So that way it is like a Dubai airport. London jana, France jana, America jana, kahin bhi jana, Dubai airport mein land hoke wahan se jaoge. Similarly, Singapore airport mein land hoke wahan se Australia, everywhere you will go. So pterygopalatine fossa is like that. So what are the contents of this fossa? Maxillary nerve, terminal part of the maxillary artery and its branches, they are the contents of pterygopalatine fossa. Now what are the structures which pass through the jugular foramen? This is an interesting question. Inferior petrosal sinus, glossopharyngeal nerve, accessory spinal nerve, they are all passing through the jugular foramen. So भैया यहाँ होता है, you should know, अगर स्कल को उल्टा पुल्टा करे तो स्कल के नीचे क्या होता, स्कल ऊपर तो आपको मालूम है कुछ भी नहीं रहता, स्कल के बेस में क्या होता, you have to be 100% sure. So here this is the place for the mandible to come and fit, mandibular fossa. Then here you have a carotid foramen. Then here you are having jugular foramen. Jugular foramen. Now we are talking about this jugular foramen. What are the contents? So in the jugular foramen you have the glossopharyngeal nerve, and the branch of it is called Jacobson's nerve. Similarly, in the jugular foramen, you have the vagus nerve, and the branch of the vagus nerve, which is called nerve of Arnold, is what you need to remember. So basically, if you look at the jugular foramen, the middle part has 9th, 10th, 11th. And map. Map is meningeal branch of ascending pharyngeal artery. These are the constituents of the middle part of the jugular foramen. So posterior part of the jugular foramen, you have internal jugular vein, emissary vein and occipital artery. Emissary vein in the posterior part will go to the sigmoid sinus and finally drains into the occipital vein. Now comes the next favorite question. The topic is all foramina in the body. What are the contents? What are the boundaries? You have to be 100% sure. So through the optic foramen, what passes? The optic nerve, ophthalmic artery, doesn't matter, they all pass to the optic foramen. So optic foramen, mnemonic क्या होता है? Cus. What is cus? Cus means COOS, cus. Central retinal vein, ophthalmic artery, optic nerve, sympathetic nerve. That is cus. Superior orbital fissure. What is the mnemonic? Suddenly French cavalry kahan se aa gaya? Lazy French tarts sit nakedly in anticipation. That used to be a USMLE mnemonic. So the order of nerves which are passing through the superior orbital fissure from superior to inferior. You have to be 100% to remember. Lazy, lacrimal nerve. Then frontal nerve. Frontal nerve is a branch of the ophthalmic division of the trigeminal nerve. Trigeminal nerve got 3 branches. What are they? Ophthalmic, maxillary, mandibular. In that ophthalmic, you have a frontal nerve, which is a branch of the ophthalmic nerve. Then trochlear, superior division of oculomotor and nasociliary. Nasociliary nerve is once more a branch of ophthalmic division of the trigeminal nerve, is what you need to remember. Then inferior division of the oculomotor nerve and abducens. Practically all the extraocular muscles supplying nerves are all passing through the superior orbital fissure. Foramen ovale. Remember male. Male for ovale. M is mandibular nerve, accessory meningeal nerve, lesser pituitary nerve, emissary vein which goes to cavernous sinus to pterygoid plexus, pterygoid venous plexus, and occasionally anterior trunk of the middle meningeal artery is what you need to remember. Foramen Spinosum. Remember, men are very spinous. Men. Middle meningeal artery and vein, emissary vein, and nervus spinosus, which is the meningeal branch of the mandibular nerve. They pass through foramen spinosum. Foramen lacerum. You should remember Meeg. All these foramina, doctor, what are the contents passing through that? Okay. Tips mein rehna hai for the tomorrow's exam. One question definitely comes. Meningeal branch of ascending pharyngeal artery, emissary vein, internal carotid artery, greater pituitary nerve, they're all passing. Then carotid canal, internal carotid artery, and the venous, internal carotid, the sympathetic plexus around the internal carotid artery, they pass through carotid canal. Stylomastoid foramen. Through that passes the facial nerve and posterior auricular artery. Then internal acoustic meatus. Through that what will pass? Facial nerve, auditory nerve, the nervus intermedius of Risberg and labyrinthine vessels. They all pass through internal acoustic meatus. Lastly, hypoglossal nerve. What passes through hypoglossal nerve? Canal. Hypoglossal nerve, meningeal branch of hypoglossal nerve, meningeal branch of ascending pharyngeal artery, then emissary vein, and so these are the important structures passing through hypoglossal canal. So this is a very important story, doctor, but you have to remember, invariably, whether it is good, bad, painful, happy, don't care. You need to have these things in your tips. Now comes the next favorite question of the examiner. Fatafat answer karo bhaiya. Who is going to give me the answer? All these structures pass through the lesser sciatic foramen. Are you ready with your mnemonic? Is very important. All these structures pass through the lesser sciatic foramen, except, who is going to shoot me the answer? Anjana, Deepthi, Manali, Vidya. Come on. They all pass through. I'm waiting for your answer. Lesser sciatic foramen, greater sciatic foramen. You have to know clearly about what are the structures that pass through. Yes. Come on, punch your answers, doctor. Yugender Bobby is betting on pudendal nerve. Good. No, sir. You should remember PIN, 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 when it comes to lesser sciatic foramen. Pudendal nerve, internal pudendal vessels, naruto-obturator internus. In fact, you should remember pinte. T is tendon of obturator internus. They all pass through the lesser sciatic foramen is what you need to remember. Then what are the structures passing through greater sciatic foramen? Below piriformis, typically snip. S for sciatic nerve, naruto-obturator internus, snip, nip. So S for sciatic nerve, naruto-obturator internus, internal pudendal vessel, pudendal nerve, naruto-quadratus femoris, inferior gluteal vessels, and posterior cutaneous nerve of thigh. They're all passing through the sciatic foramen below piriformis. That's the point you need to appreciate. Foramen Spinosum. What does it transmit? It transmits middle meningeal artery, emissary vein, meningeal branch of mandibular nerve, just before we discussed. Foramen Spinosum is men, middle meningeal artery, emissary vein, and nervus spinosus. Foramen rotundum. Come on, should be your answer, doctor. Question number 56. Yes. What are the structures which are passing through foramen rotundum? I'm waiting for your reply. Foramen rotundum. Yes. What are the structures passing through foramen rotundum? Lawrence, after a long time, I'm happy to see Lawrence. Lawrence is reminding maxillary nerve. Very good, very good. So, doctor, you can remember rotomax pen, foramen rotundum, and the maxillary nerve is what you need to remember. Structures passing through foramen ovale, male. There is mandibular nerve. So you can also remember aortic ganglion, mandibular nerve, accessory pharyngeal artery, lesser petrosal nerve, and emissary veins. So ovale, male, one method of remembering. Second method is ovale, O for even aortic ganglion, mandibular nerve, accessory pharyngeal artery, lesser petrosal nerve, and emissary veins is what you have to remember. That comes the end of the second grilling topic, doctor. So let's go to the next topic before we conclude our afternoon lunch break with Dr. Murali Bharadwaz. Once more at 9 p.m., we are all going to meet to continue our journey with anatomy episode 3. Meanwhile, please download the Incus quiz app and try to play all these quiz tournaments like all these topics and questions as a tournament. Diaphragm aperture, all of you are experts. You have to quickly punch your answers parallelly along with me. Aortic opening of the diaphragm. It has both azygous vein and thoracic duct. You can remember ta. So vena cava opening, you have right phrenic nerve. Esophageal opening, you have the vagus. Aortic opening, you have thoracic duct and azygous vein. In addition to aorta. Now, Bogdalek hernia is basically a posterolateral hiatus hernia, is what you need to remember. Esophagus crosses the diaphragm at the level of T10, Voice of America. Vena cava opening 8th, esophageal 10th, 12th is aortic opening. Right phrenic nerve passes through the vena cava opening. Then aortic hiatus in diaphragm transmits azygous vein. Foramen of Morgagni, it is typically located in the diaphragm. Aortic opening carries azygous vein, thoracic duct, and is what you need to remember. So that is a quick story of the diaphragmatic openings. So the next favorite area that we will discuss among the high yield areas, 953 topics. Ear. Lot of times anatomy of the ear is a favorite area for the examiner. So the infection of the CNS, अगर meningitis कुछ ना कुछ हो गया तो, how is the brain calvarium, cranial fossa is connected to inner ear? It is the cochlear aqueduct through which it is connected. भैया जरा idea रहना है आपको, what are the various structures, how are they located, everything. So all of you know these are semicircular canals. This is the endolymphatic sac. This is the vestibular aqueduct. This is the cochlear aqueduct connected with the CSF. And how is it connected? Scala tympani. Scala tympani is connected. So here you have the scala media ending up into saccule, and from there the vestibular aqueduct and the endolymphatic sac, whose dilatation is called Meniere's disease. Then this is the area which you call utricle, and these are the semicircular canals. So it is the cochlear aqueduct which typically connects the scala tympani with the CSF. Then endolymphatic sac, how is it formed? Whenever the utricle and saccule combine with each other, they combine with each other. That ends in endolymphatic sac. So there is a fissure called Hirtel's fissure, which you need to know. Hirtel's fissure is also called tympanomeningeal hiatus. It is an embryonic remnant that connects the CSF space with the middle ear, and it is typically located just anterior to the round window. And it runs parallel to the cochlear aqueduct. Normally it gets obliterated, but sometimes it can be a source of congenital CSF otorrhea or meningitis. Endolymphatic duct typically drains the subarachnoid space. Inner ear, it arises from the aortic capsule. Birth only, at the time of birth only, adult size is achieved by aortic capsule. So from the aortic capsule comes the mastoid and the petrous part of the temporal bone. So the ossification of this aortic capsule, it starts at 16th week and it is completed shortly before birth. The aortic capsule is already adult size by the time of birth. Then one more thing, the pinna. The pinna will achieve the adult size by the time it is 5 to 6 years. By the time the kid goes to the school, the pinna has achieved the adult size. So once more, examiner ka favorite question in the topic of the year is adult size before birth, after birth is very important. So the ossicles in the ear, malleus, incus, stapes, they all attain the adult size before birth. Now, what is the blood supply of the middle ear? You have to be very sure. Posterior auricular artery, posterior tympanic artery, stylomastoid artery, not a deep auricular artery. Now we come to another batti marne wala item aa gaya. Be very sure. Branches of the maxillary artery is the favorite question of the examiner. Maxillary artery ko ek first part, second part, third part. The first part comes deep auricular, middle meningeal, inferiorly, and tympanic antermeningeal. Second part, deep temporal, pterygoid, masseteric, and buccal. Third part, greater palatine, artery to pterygoid canal, infraorbital pharyngeal, and spinopalatine artery, which is called the terminal branch of the maxillary artery, is what you need to remember. So the deep auricular branch, or the first part of the maxillary artery, derives from the anterior tympanic artery. So it does not supply middle ear, rather it will pass behind the parotid gland, and it supplies the skin and tympanic membranes exterior and the temporomandibular joint. They are all supplied by the deep auricular branch, which is the branch of the first part of the maxillary artery, is what you need to remember. Where do you have the suprameatal triangle? It overlies our mastoid antrum. So the mastoid antrum, if you take, it is full adult size right at the birth. and it is covered by 3 millimeters of petrous bone deep to the floor of the suprameatal triangle. So this is the suprameatal or inferior temporal line. Then this is called McEwan's triangle. A lot of times examiner will ask you what are the boundaries of McEwan. So the McEwan triangle is also called the suprameatal triangle or mastoid fossa. And it has the anterior, superior, posterior. Anterior is the posterior root of the zygomatic arch. This is the zygomatic bone. The posterior root of the zygomatic arch is anterior. This is front, this is back, doctor. This is the mastoid bone. Then superior will be the posterior root of the zygomatic arch. Anterior will be the posterior border of the external acoustic meatus. This is the external acoustic meatus, typically anterior root of the zygomatic bone. Posterior aspect will be superior, and the line joining the two. So that is called McEwan's triangle. So that is a quick story about the topic, which is the ear. So अब तक हम 8 टॉपिक्स का रिवीजन किया, and in these 8 topics we finished almost 75 MCQs. और आगे बढ़ेंगे. Once more in the night, 9 p.m. tonight, you have the episode 3, and अगर कोई लेक्चर सुने तो भूल जाएंगे, क्विज खेले तो it will challenge your mind. And when you discover that how your friends are remembering, how they are scoring, and for every question you can leave an audio, video comment, handwritten notes, anything you can leave on the Incus quiz app, which will be useful for everybody. So I welcome you all to download the Incus quiz app and play the quiz tournaments for NEET PG. 1000 quiz tournaments, 20,000 MCQs. फिर मिलेंगे tonight at 9 p.m. Have a great afternoon and enjoy a wonderful time in preparation for NEET PG with full optimism, only optimism. No regrets, no past, no nostalgia, no pseudo guilt feeling that we did not study well. अभी आपको एक 100 days का runway मिल गया. अभी शुरू करें तो भी आप you can become the astronaut to become a NEET PG topper. Good to see you all. Thank you.